I founded Charter in 2008 because I've been referring into treatment facilities for absolutely years. I've worked as an addiction therapist since the mid-90s, and I used to refer people into residential rehabs, and I became increasingly disillusioned with the quality of recovery that was coming out. I also found myself with people I was working with in the one-to-one environment who could do with treatment, but not something as extreme as residential rehab. So I had written a model of care in 1989, 1990 when I came out of treatment, and I started toying with it in about the early 2002, 2003, and really put it into action in 2008, as I say, when I launched Charter. We're a daycare, which is immediately a difference in terms of treatment. We work with addiction, relational trauma, and some mental health issues. Predominantly in group. I do believe that addiction in particular is treated best in group. Of course, you can work in one-to-one, and we do provide one-to-one work. But if you get an addict in a one-to-one environment, then they're likely to set up the kind of relationship which could be collusive. It could be really protracted, and if you get an addict into group, working with other people who are in group, then you have the benefit of mutual identification. You can really expedite a process, which an addict really likes, because we all want answers nice and quick. And you fracture the isolation, which is fundamental to any addictive condition. So what I did is I set up Charter ostensibly to work with addicts, working in group therapy. That was 2008. And then it grew, very quickly it grew. So we added individual counselling, psychotherapy for people who left treatment, family sessions, couples work, which is one of the things I do an awful lot of, and as I say, group therapy. Some people found that because they wanted to stay at work or stay working, that they weren't able to attend our daycare program, which is 5 days a week. So we set up flexi attendance, so people could come to the daycare for, say, 2 weeks and then come a day a week, 2 days a week, according to assessment. And out of that evolved our evening program, which is 3 evenings a week over 9 weeks. So what we're trying to do is to work with people as early as possible, as soon as they realise they've got a problem, offer them the support, offer intervention, offer them a community, so that they don't have to get so bad that they lose their jobs, they have to go away to residential treatment. We allow people to, or really support people to get well and not lose everything. Something that was really important to me at Charter is that everybody is an individual. So I may have a formula, which I do, through which I understand addiction, and I talk, across the country on this subject. And there is a formula. However, every single person that walks through the door has a different experience of, if you like, that formula, how addiction plays out in their family, or how the relational trauma has played out in their lives. And we remember that here. So I have a very experienced team. I mean, I think everybody has clinical experience exceeding 10 years. We've all known each other for a long time. We're very flexible, and we really try to engage with every single person that goes through our door, that comes through our door, as a person. We get to know them, they get to know our admin team. We all work in group with one another. And I think that as a result of that, people open up, they're less defended when they come here, because they know they're not going to get patronised. I mean, genuinely, we want to help you.